Hello, everyone, and welcome to today's webinar, Practice Building with the GI Map. Today's presenter is Dr. Dan Kalish. Dr. Kalish, IFMCP, is founder of the Kalish Institute, an online practice implementation training program dedicated to building integrative and functional medicine practices through clinical and business courses. Since 2006, the Kalish Institute has helped develop practice modules for over 1,000 practitioners worldwide. Graduates of the Kalish Institute include practitioners ranging from the Director of Integrative Medicine at Mayo Clinic to Cleveland Clinic Function Medicine physicians. In 2017, Dr. Kalish became lead faculty for the Institute for Functional Medicine Practice Implementation Program. He also began a strategic collaboration with the Institute for Functional Medicine through co-development of a new course, My Practice Plan. The course curriculum focuses on the development of business models for those entering the field of functional medicine. So Dr. Kalish, take it away.
Thank you so much for having me back. So now we get to talk about my favorite thing, which is practice building, which I love, combined with my other favorite thing, which is GI map testing. And so this goes back, 30 years ago when I was first learning how to do this work. I worked with a naturopath named Dr. Bill Timmons, passed away a bunch of years ago. And to see Bill and his practice, before you could walk in the door and talk to him as a doctor, you had to do a GI test. He'd like literally wouldn't talk to a patient until he had a digestive test in his hands. Wouldn't even give you the time of day. And so that's how I grew up in my naturopathic training. I'm a chiropractor by license, but um, I was trained by naturopaths primarily. It's kind of like those movies you see on TV once in a while. It's like a boy that's lost in the woods and he gets raised by wolves and he thinks he's a wolf or something. But anyways, I kind of act like I'm a naturopath, but I'm licensed as a chiropractor. And that really stuck with me. I was like, gosh, if Dr. Timmons does that, maybe I should do that too. And so we want to talk about now, 30 years later, woo, the technology has changed. Used to be people looked under microscopes to find these things. Now we have DNA testing. The the leap forward of that is just hard to wrap your mind around. There's a man named Lou Van Hook, right, who was the first guy that invented a microscope, and he started to look around and see all these bacteria and stuff. And at first, for like the first 10 or so years that he invented his microscope, no one else could figure out how to make a lens that good. He was a lens creator, builder. And everyone thought he was mentally ill because he talked about seeing all these things no one else could see in the water, right? And so that was a big breakthrough. We could see under a microscope. But what now is possible with the GI map is you can see using a DNA test. That is like such a quantum leap forward. It's hard to even wrap your mind around. I wish Dr. Timmons was alive to see this, because now we're at this whole other level of ability to understand how this stuff can be identified. Okay, it's really a huge leap forward technologically. And if you haven't been around since the days of the microscope, when I first started my practice, that's all you had really. You send out a stool sample, you got a human being in a lab looking under a microscope, and good luck finding this stuff, right? It's a needle in a haystack kind of thing. Now you send in one of these GI map tests, and it's this complex DNA array machinery stuff that's amplifying things and spits out this result that's extremely, extremely accurate. So that's just another thing to be appreciative of. But today's talk is more about how to use GI testing to boost your practice, because the reason why Timmons tested everyone's GI is because you're working with chronic health problems. Most practitioners don't check digestive function unless there's a digestive issue. And most patients that have chronic health problems that have no digestive issues have digestive problems. And so we want to kind of separate in our mindset just testing people with GI problems versus testing everybody like Timmons did. And the core central point of naturopathic medicine, integrative medicine, functional medicine, whatever you want to call this area that we're all in, the central key point is that the gut is the foundation of the body, that the microbiome creates or destroys our health, and that it doesn't matter if the person is tired, depressed, has joint pain. It doesn't matter if they have GI complaints or not. You have to do a GI test on all patients because that's the foundation of the work, And if you're not doing that, and if you're only testing based on symptoms, then you're practicing symptom-oriented medicine, and the whole thing is that we're not doing that. So want to try to convince you guys this is a good idea. It's only a couple $100 to do the lab. For the amount of benefit that your patients will receive when you find the H. pyloris and the blastocystises of the world, you shouldn't even give any consideration to the cost of the test. It's a minor blip in the economic life of your patient. And for the amount of information you can get from it, and the amount of health benefit they can achieve, it's a non-issue. So you should just be handing these out to every single person. And if you have that confidence um, and that sense of naturopathic functional medicine, what do you call it? And it's not a spiritual thing, but a sense of calling and a sense of really wanting to help people and realizing that the microbiome is the center place for all of our health. That you have that kind of internal confidence in your own ability to understand the gut. When you hand the test kit to the person, they're just going to do it, okay, and they won't worry about or complain about the money part. If you're not testing every single new patient with a GI test now, then you need to just work on your confidence and understanding about why the microbiome is so important. And hopefully we can get some information out to you today about that. So convincing patients about doing the GI testing if they don't have GI problems, and what's the value and purpose of testing. If you find Giardia, should you test the whole family? Probably, right? Because it's easy to pass Giardia on. Um, certainly within a married couple, if they're having sex or sleeping together, or sharing the same kitchen. So one of the ways that I unintentionally built my practice was saying, hey, it looks like you have cryptosporidium, Susie. I don't know, your husband has chronic diarrhea. Maybe we should test him too. And so, one stool test can lead to many. And of course, everyone wants to check their kids. And I found all these years of talking to moms about their kids, okay, so you have 3 kids. There's always one kid out of the 2 or 3 that has chronic tummy problems when the mom has crypto. And saying, well, if we can't afford to test all your children right now, let's at least test Bruce, who's the 10-year-old that complains about stomach pain every time he eats. So, and this is not like a marketing strategy, although it does very good for your business. This is just like taking care of people strategy, right? And being compassionate, caring about people and their spouses. And you also, with the primary patient that you're starting off with, you don't want them to get reinfected, right? So if someone has crypto and the husband has crypto and you treat her crypto and then it's gone and she gets her crypto back, like how many times do you want to do that? I had this one case once where I think she got it back from the boyfriend like twice. And at the end of that process, he was like, look, dude, either you do this stool test with Kalish or this relationship is over because I'm tired of having this crypto thing keep coming back. And I think it's you. And she kind of pointed the finger at him and he finally did test. So anyway, super important, to check family members and make sure that you expand your understanding of this work to, more of it's almost like a social service kind of thing where you're wanting to help whole families, not just individuals. Also, one of the, if I look back, as I often do, unfortunately, on all my major clinical errors, times when maybe I didn't do the wrong thing, but I didn't do the right thing either. They oftentimes revolve around not having checked someone's GI tract early enough in the process. And it's a bummer when you're 6 months into some kind of complicated neurotransmitter program and the person isn't getting any better and you're like, oh, maybe we should check your gut now, right? So you've just burned through 6 months of their life and your life, thousands of dollars of labs and supplements and stuff, and then you come back around and you find that they have blastocystis at month 6. It would have been way cheaper and more efficient to just do the bloody test up front and figure it out from the very beginning. And this explains why Dr. Timmons wouldn't talk to a single patient until they had done a test. So that may seem a little extreme, but it's not really when you start to think about this when you've been doing this for a while. So first step is do the test, right? And then convincing them why to do the test, why it's important. It's not the easiest thing to do. So I have this thing I like called a condition description technique, which means that for whatever condition that they have, you should have a description about why they should do the stool test. Because you got to talk people into this. It's not intuitively obvious. If I went to my regular doctor and I said, I've got this rash on my elbow. I've never had a rash on my elbow, but I'm making this up. I have this horrible rash on my elbow, and what do you think I should do? And if she said, well, let's take an x-ray of your left knee. I would be like, that's a little crazy, lady, because like the rash is on my right elbow and my left knee has never bothered me. So I get it that, you suggesting a test for someone without any GI problems, it seems a little wackadoodle to the patient because they're like, well, why would I do a GI test, doc? I've got, a rash on my right elbow. And you have to have this condition description technique. If you get good at this, you can sell 100% of your patients a GI test, whether they have, now if they have GI symptoms, it's kind of obvious and easy to do, right? We want to work on the harder ones. So let's say that they have an immune problem, an autoimmune problem, Hashimoto's, rheumatoid arthritis, scleroderma, any kind of autoimmune disease, or they're just worried about their immune system. They don't want to get a virus and drop dead, and they want to have a strong immune system. You can honestly say, I know you're worried about your immune system or your autoimmunity. 60%, maybe more, of your immune system is in and around your gut. Your microbiome, the gut bacteria, the good gut bacteria, absolutely direct and control immune function. And what scientists have found in the last 10, 15 years is that if this balance of good bacteria in your digestive tract is not right, you're going to be very prone to autoimmune problems or a weakening of your immune system, which could make you prone to picking up a virus. If they come in and they say that they have an inflammatory condition, like their joints are sore everywhere, you can say, well, we want to do this test for your digestive tract because we find that chronic low-grade digestive tract inflammation can often be the source of inflammation in other parts of the body. And we want to check and make sure that this vast area of your body is not inflamed by doing this test. Or if they have, let's see, let's pick what's a really common one? Oh, let's just say they're tired all the time, right? They're just fatigued and depressed. You could say, well, I know you don't have any digestive problems, but this chronic fatigue and long-term depression may have part of its origins in your gut. And we find that in order for your nervous system to function, for your brain to get the nutrients it needs, all the things that make you healthy and energetic, your mitochondria, they all have to be supplied with nutrients that come from, guess what? The food that you're eating, combined with the ability of your body to absorb. So if you have malabsorption, if you can't absorb nutrients well, you're not going to be able to get the nutrients that you need into your brain or into your mitochondria, and that could be part of why you're tired. So anyways, you want to kind of practice these through and make sure that for each common condition that you treat, you have a really good reason or explanation why they should do the stool test. And it doesn't take more than 1 minute or 2 minutes of your time, and then you hand them the kit and they should happily pay for it. If they are still looking at you like you're a little crazy, like why would you take an x-ray of my left knee when I have a right elbow rash, then you didn't explain it well enough. I don't know, you could try again and maybe just give up on that patient and try the next time you get a new patient. But once you get good at the condition description technique, 100% of your people will buy a stool test, okay? And you'll be just like Dr. Timmons. So I like to do these things in steps. And so if you want to start with mastering this sort of condition and then describing why you should do the test, think about these big five: weight gain, fatigue, depression, hormone imbalances. Of course, digestive issues are kind of an obvious and easy one. And, practice a few times. I even have some scripts on this I can share with you guys if you want to see some scripts on it. But you get the general idea. I'm trying to give you the scripts now, right? Someone's gaining weight. You can say, well, we can do all these, complicated things for you to lose weight. But what we find is if you can't digest and absorb your nutrients well, you're going to tend to overeat because people eat until their basic nutrient requirements are met. If you have malabsorption, your appetite's going to go on forever and you're going to tend to overeat, but not digest the nutrients real well. So you're going to end up with too many calories and put on weight. They also find that the microbiome has very, very powerful control over your metabolic rate. And so to a certain extent, if you have a good balance of good bacteria in your gut, you'll be able to burn calories more efficiently and you can lose weight just from correcting your microbiome. So those kinds of things, okay? Uh, and then, just from a business perspective, practical perspective as well, the value and purpose of follow-up testing. So, a lot of people are pretty good. They do that first test, the crypto is found, patient seems to be better mostly, but they don't do a follow-up test. Now, the problem with that is that you don't really know if you just suppress the crypto and it's going to come back, And you don't really know if they're having this problem in layers. A lot of patients have layers of these problems, right? So by layers, I mean you get rid of the crypto, happy that's gone, you retest them, and Dientamoeba fragilis shows up. I've had patients with as many as 7 of these layers, where as we tested throughout a series of 4 to 6 month time intervals, we found infection after infection after infection. So sometimes you don't capture all the information on the initial test. You have these bugs that can become deep-seated infections. They get burrowed down deep into the crypts in the intestinal tract lining. And as the person's getting better and you get rid of one infection, you can see a more deep-seated infection showing up on a future test. So follow-up testing has a couple of benefits. One is you make sure that the crypto you found in the first test is gone. The other is that you make sure that the coast is clear, right, and there's nothing else going on. So I really try to push people, especially if they have a serious parasitic problem, to make sure that they retest. Usually it's around 4 to 6 months after the initial lab, okay? It's also really good from a patient and sort of satisfaction perspective. Like we all take tests and fail. That's kind of like, oh, I took this stool test, I have crypto. But it's really, heartening to take a test and pass. And you do the lab and the crypto is gone. You can kind of congratulate yourself a little bit and say, hey, I guess that herbal program really worked. And then also congratulate the patient and say, gosh, you must be feeling so much better now that you don't have crypto. So there's something also nice, kind of heartwarming about retesting when it's normal to just prove that the whole program worked. The other thing is that uh, have a bigger picture here, and I have a more detailed slide on this in a minute too, where we're trying to lay out perspectives for the patient. We're trying to lay out models. We're trying to lay out a bigger picture. So they don't just see this as an isolated digestive problem. They're doing a stool test and then it's better, right? We want to have a more, I don't like the word holistic. It sounds kind of hippie-ish, but we want to have a more nuanced and extensive view of why we're really doing this. Like, what's the whole point of doing this? And it's more than just making sure they don't have heartburn anymore, right? We want to also be able to set up the next steps and plan out what's next for the person when that heartburn is gone, and moving them into a long-term maintenance program. Because you want people to stick around, right? You don't want to just fix their heartburn and then they go away forever. You want to have patients to have a reason why they see you every 6 months or once a year, so they can move into this higher level of health beyond just not having heartburn. And so thinking about the third bullet point here is, why are you doing this? Like, what's the long-term game plan here? What's the long-term success of a case look like? Is it just to get rid of symptoms, or do you believe there's something more out there than just not having heartburn? What's your deepest belief on that level? And for me, I believe that functional medicine is our platform for emotional and spiritual growth. That's my little, vision statement. Functional medicine is a platform for emotional and spiritual growth, meaning that we're not on this planet just to not have heartburn. We're on this planet to have a deep and rich emotional life and a spiritual life that makes all this stuff we have to deal with being human beings worthwhile. So if someone's heartburn is gone, I want them to know that functional medicine has more to offer than just symptomatic relief. Okay. And we got some more information on that coming up in a second too. So and this is another thing that kind of crippled me for a long time, is that it's fine if the testing is normal. Don't get freaked out. That means you just ruled out a huge problem, right? So doing a test and having it come back normal, you should congratulate the person. This is really great. Your test is normal. I'm happy to see that, and not to have that be upsetting in any way. Okay, so if you look on the far right-hand side, we have symptoms. And again, this is my schematic for how all this stuff works. So you can have weight gain, depression, fatigue, anxiety. But on the far left-hand side, underlying cause, you can see GI infections is right near the top. So a GI infection can cause anything from insomnia to allergies to sex hormone imbalances to depression or fatigue or weight gain. There's not a one-to-one here, right? Every individual patient will have a different set of symptoms specific to their genetics based on their GI infection. So you don't always see H. pylori causing the exact same set of symptoms. And part of the patient education process is to let people know, if you have a GI infection, then you're going to become inflamed. You're going to have a lot of oxidative stress. Your gut's not working real well. You might become insulin resistant if it goes on for long enough because of all the inflammation, tissue damage, cortisol gets out of balance, all that stuff. You're definitely going to become catabolic. The gut lining is going to start to get chewed up. That may affect either neuroendocrine or liver detox issues. Obviously, it's going to affect your GI tract. But the symptoms may be weight gain, fatigue, depression, or anxiety, even though the problem is in the GI tract. And this again is, patient education 101. If you're in your easy cases, you have a GI infection, they have a GI problem, body system problem that they know about, and they have GI symptoms, right? But it doesn't always work that well because anything of this can cause any of these other things. And in fact, a GI infection could cause brain fog or anxiety, or it could cause allergies or fatigue, right? And so we need to be able to kind of wrap our minds around that and not just think in a limited way about all this stuff. So again, this is just kind of thinking through why we're doing in this and what this is all about, and how does the GI map stool test even fit into optimum health. And the central component of naturopathic medicine for generations, for centuries, has been if your gut is healthy, the human being is healthy. And I would challenge you and I would say, if you find somebody with a perfectly balanced microbiome and without any gut infections, that is going to be a very healthy person. You will not see people with perfect guts that have all kinds of chronic health problems. It just doesn't exist out there, right? That's how central this whole thing is. So if you're trying to move people towards optimum health, then you want to have this, bigger picture vision of the gut as being responsible for, giving ourselves, in a sense, all the nutrients that all the different body systems need. All right, so, and I use these, kinds of slides with patients as a, basic patient education kind of thing. GI function, dysfunction occurs without GI symptoms. We want to drive that home to your patients. If we're treating the underlying cause, why do we only run GI tests sometimes? It seems kind of silly. We want to do them on everybody. And then in terms of treatments, I want to just show you a really simple, practical way to look at the test. And these are obviously helpful for patient education purposes, right? And an educated patient will buy labs, an educated patient will buy supplements, an educated patient will get better. And when I think about it from a treatment perspective, we're thinking, okay, here are the potential things that you might want to do. Prebiotics, probiotics, fiber, maybe enzymes, gallbladder support, gut repair, immune boosting. Maybe you need to kill something, parasites, bacteria, yeast. So there's only really like three big categories of things that you need to wrap your mind around. Are you going to deal with the microbiome stuff? Are you going to deal with GI organs, or are you going to kill something? And so when you're looking at these labs, it can be daunting, especially if well, it can be daunting for a couple of reasons. It can be daunting because you're relatively new and you don't know how to interpret these, or it can be even more daunting if you've been doing this for a long time and you know a lot, but it's hard to explain to a patient what you need to explain to a patient. And I think either way, there's a sort of stress point for physicians in that if you don't know a lot, you don't know what you're supposed to be talking about. You don't have the confidence. And if you know a lot, then it's hard to simplify it to the point where a regular person without a medical education is going to understand what you're saying. And so breaking it down into these stages that I use, super helpful from a patient education perspective. And you can do this in a 20 or 30-minute consult, and the patient can walk out feeling like they really have confidence in you because you really know what you're doing. And to not, you don't have to, the sign of a super smart person is someone who can simplify really complex stuff. The sign of a really smart person is not someone who can spout out stuff that sounds really smart, you know? If people don't understand what you're saying because you're such an expert that the words you're using are too complicated, then you're not communicating. And that's not that smart, is it? Right? And so the smarter that we get clinically, the more likely it is that we're going to have explanations that our patients don't understand. And if patients don't understand, they're not going to think that you're this really smart person that's amazing. They're just going to get confused and not know what to do. So anyways, I have this system if you want to use it, or if you don't like it, then you should have a similar kind of system that's easy to explain. 3 stages of GI dysfunction. Okay, and these are progressive. First stage, you got a microbiome that's messed up. Pretty much everyone in this worldwide scientific community agrees that that's a super horrible thing to happen. Number two, you have an organ that's not working right: gallbladder, pancreas, small intestine, stomach. Number three, you got a pathogen, something that you got to kill. Okay, so 3 stages. And so the lab should, as you're explaining the lab to a patient on a practical level, you can let them know, okay, you've got this going on, this going on, this going on, or not. And so it's pretty straightforward. So this is progressive, right? So when you're first under assault, your GI tract, emotional stress, diet's not that great, your microbiome's starting to kind of fade out, not so good. And you'll see that on the commensal or normal bacterial markers. And I'll show you an example in a minute. Stage 2 is, this has been going on for a while, this is not good. Now the organs are getting messed up. Now my stomach's not making enough hydrochloric acid. Now my gallbladder's not making bile right. And you can see all this on the lab, right? Now my gut is kind of leaky and inflamed. All this shows up on the GI map. So now you know there's organ involvement. Microbiome involvement, stage 1, now organ involvement. And then stage 3, this has been going on for a while. The immune system is weak. Gut immunity is not doing well. Pathogens start to become a problem: parasites, bacteria, yeast that you need to kill. Okay, so these are the 3 different stages. And again, for a patient education perspective, pretty simple. Stage 1, disturbed microbiome, just simply the normal bacteria out of balance. And how hard is that not to figure out? I don't think it's very hard. You just go to the point of the lab, go to the part of the lab that says normal bacteria. Are they out of balance? Yeah, they are. So, okay, boom, you got it. That's the whole diagnostics process. Do you need to know what Akkermansia does? Yeah, you should learn that. And it's like a really cool organism. And it's this massive anti-inflammatory thing. And what does it mean if it's high or low? I mean, you can get into that level of detail, and you should, as you learn more about these tests. Do you need to know that right now? Not really. A patient's going to ask you? Never. No one's ever asked me, what does Akkermansia do? But you should kind of know that, but you don't have to, study that when you have some time. There's one on here you should know though, because this is like a no-brainer: lactobacillus, right? Because there are a lot of probiotics that we sell have lactobacillus in them. So if lactobacillus is low, can I take a lactobacillus probiotic and make it better? Absolutely, that's probably a good idea, right? So that one's kind of obvious. But anyways, normal bacterial balance, is it balanced? Here we have 3 lows, 1 high, kind of obvious it's not. And that's a stage 1. Poof, you just diagnosed your first stage 1, easy peasy. And now you could talk for hours about what that means. A disturbed microbiome causes neurological disease. We know a disturbed microbiome happens in diabetics. We know a disturbed microbiome happens in cardiovascular disease. We already said a disturbed microbiome, more research studies than you could ever read about how a disturbed microbiome affects your immune system. More studies than any human could ever read about that. Thousands and thousands of studies on how a disturbed microbiome affects. And just Google it. Don't go right now. Give me another 10 or 15 minutes to finish the talk. But as soon as the talk is done, Google disturbed microbiome and breast cancer, or whatever condition that the patient has. That's how you can get your condition description technique together, right? So patients coming in tomorrow morning with autoimmune thyroid disease. So then just Google tonight, microbiome problems and thyroid disease. And then you can say, when the patient comes in, I know you have a thyroid problem, but there's a lot of research that shows that the microbiome is really relevant to this. I think we should test your microbiome. And then don't get all nervous. When the lab comes back, just look at the normal bacterial section, and you can say, some of these markers are low and some are high. Susie, you have a disturbed microbiome. We need to work on that. You're what I call stage 1. It's this early stage of problems with your gut. Okay, so there we just did a whole case right there. Treatments for the stage 1 people. Pretty straightforward. Fiber, prebiotics, or probiotics, or all 3 if you want. Well, we could do all 3 depending on the bandwidth of the patient. Fiber, so the good bacteria can grow. Prebiotics, so the good bacteria can grow. And then probiotics are the good bacteria, right? You're attempting to get balance back in the intestinal tract lining. And all the companies that we work with, supplement companies, have fiber, prebiotics, and probiotics. Just ask your sales rep, what's the best prebiotic you guys carry? what's the best probiotic. You can go from there. So there we got it. Stage 2, stage 1, microbiome. Stage 2, now the organs are not doing well. Gallbladder, pancreas, maybe the small intestine. You're going to have poor digestion, malabsorption, degradation of the immune response. The leaky gut is happening. The inflamed gut is happening. It's just kind of like a living nightmare. But it's not just the microbiome organ. It's, it's considered an organ almost to itself. Now it's your organ. It's that human's organs are now directly involved. How do you tell? Well, you look at the test, and they conveniently have packaged this all in one little section, way down at the bottom here, called intestinal health. So if steatocrit is abnormal, that's a gallbladder problem. If elastase is abnormal, that's a pancreatic problem. If secretory IgA, calprotectin, or zonulin are abnormal, then you've got an intestinal lining inflammatory / immune problem going on. So you can tell right away, how are the organs involved? Are they involved? Gallbladder, yes or no. Pancreas, yes or no. Intestinal tract lining, yes or no. It's right there on the test. And you can just tell the patient, hey, this marker means that you have organ involvement now. It's a little, more severe, really. Now your body's not doing well. And what are we going to do about that? Well, if the steatocrit is abnormal, you prescribe gallbladder support. Every supplement company we work with will have 2 or 3 gallbladder products. Just use a good quality company, elastase is abnormal, you give them pancreatic enzymes. Secretory IgA, calprotectin, zonulin, you got to put them on a leaky gut repair anti-inflammatory support program. Now you've got your stage 2 script, kind of. You go to that section, you look for organ involvement, you tell them which organs are involved, and you do the appropriate treatment. Sometimes people might have all 3 of these things going on at the same time. So stage 1, microbiome, stage 2, organs, stage 3, GI pathogens. These are my favorite things to deal with. And so these are infections, but why did they happen? Because the microbiome was weakened, the GI organs weren't working real well, and then person got stressed and it set them up. So a stage 1 becomes a 2, becomes a 3. So you can't just kill parasites, bacteria, or yeast without addressing the microbiome component and the organ component, or the problem will just come back. So if they have like blastocystis hominis, we see that all the time, and you treat it, but you leave the microbiome unattended to, and you don't address the GI organ issues, it's very likely that either they'll pick it up again or that you'll knock it down but not completely eliminate it, right? So you want to not just kill things, but understand that these bugs pop up and become problematic in a context of a weakened microbiome and weakened organ function. If the immune system in the gut lining was doing its job, and if the microbiome was perfectly balanced, that blastocystis would never become a problem in the first place. So we do want to kill things, but we also want to make sure that we're dealing with the bigger picture here. And then these are probably the easiest to find in some ways, right? Because just look for the bad red stuff here. It's a sample lab I have here. C. diff, toxin A and B. So we're going to kill that, eliminate that with a supplement program. H. pylori, positive for the virulence factors as well as for the organism itself. So again, we're going to want to, eliminate that bug. And then when you're thinking about treatment options, what do you want to do in what order? And it actually matters a lot, I think, what order you do things in. Oh, before I forget, we have a GI masterclass that we've done in partnership with Diagnostic Solutions. Done a GI masterclass in partnership with Diagnostic Solutions, and we're just giving it away because we're nice. But you only have a couple weeks to get this free thing. So if you're interested, you can get the free class. The free thing expires August 1st and goes back to, you actually have to pay for it, at kalishinstitute.com/GI map. And then the code, we tried to make it as complicated as we could. The code is GI map, all right? That's me being sarcastic. So anyways, if you're interested in getting more into lab interpretation stuff, we're going to do another one of these next quarter where we interpret labs, but you're also welcome to grab a hold of the free GI masterclass. We'll go into this in more detail on that too. Okay, so let's just talk about treatments for 1 minute, and then we'll open it up for questions. So I just want to show you a slide that has all three of these guys on it. Okay, so now this to me is the biggest question, and I get asked this by every doctor that I train in. I teach this year-long mentorship program at the Kalish Institute, and by the third or fourth month, every doctor starts to ask this question. So, and I've been teaching this mentorship program for 16 years. Everybody asks this question, so I'm going to try to address it right now. So I'm not saying I'm going to answer the question right now. I'm just saying I'm going to bring it up so you can think about it. So it really matters a lot what order you treat these things in. It matters a lot. In fact, the difference between absolute success and total failure can be doing these in the wrong order. And you have basically three choices because there's three stages. You can start the treatment with stage 3. If there's a pathogen, you just kill it. That kind of makes sense. You can start the treatment with stage 1 because it's the disturbed microbiome that caused this whole thing in the first place, and that kind of makes sense. And you can start the treatment with stage 2, maybe work on their leaky gut first, So this is where it's really difficult. And I'll tell you the best, 2-minute summary I have of this, we have about 2 minutes left here, right? Is that unless there's a reason that you have to do something else, if they have a pathogen, go after the pathogen first. As soon as it seems that that is under control, then go after repairing all the organ stuff. So that would be a leaky gut protocol, anti-inflammatory protocol, get the gut lining to repair now that blasto is gone. And then when that seems to be working pretty well, do the most important thing, which is get that microbiome back up to speed so that the person won't get sick again. You can do it the opposite way, and a lot of the senior functional medicine doctors that I know would say the opposite. They would say you should start with the microbiome and a little bit of an organ tune-up and see if that's enough. The problem with that is that it's really fun to kill stuff, and killing stuff gets people better pretty fast, and it's like a reset. So it's like a shock and awe kind of thing to their system, and it usually works really well. So I think there's a benefit to trying to do the killing first in terms of patient compliance, patient referrals, patient results, and whatnot. However, if the person's quite sick, they have a lot of liver detox issues, or they've been chronically ill for a long time, then trying to kill pathogens first can completely backfire because it'll make them really sick. So I try to treat everyone's pathogens first. If it blows up and it's not working, then I will say, I am sorry, Jane, that we did that. It sounds like we need to take a break and go back and work on your GI organs and maybe your liver a little bit first. Let's go back, let's go do a leaky gut repair program, get the inflammation down, get your body prepared for doing the GI pathogen clearing. But I always want to see if I can do it because it's a little faster if you can do the killing first. If the person's super sick and they're highly reactive to every supplement known to humankind, then you might want to start here and get the inflammation down, get the organs working better with the gallbladder support, pancreatic support, leaky gut repair. Give that a couple months and then go after the killing. Now, I'll just mention this one thing, and I'm going to wrap up and open it up for questions, is the highest level of this, and I have not achieved this yet. So I've been in practice for 28 years. I've taught a couple thousand doctors how to do this. But when I look up who's above me, there's people that have been doing this for 50 years. That's a lot. That's like twice as long as me. So the 50-year people that have been at this for 50 years, I'm just going to tell you what they do. This is not what I do, but I just got to tell you what they do. Most of them start with the microbiome. It's a little crazy. They're all old. I don't think they're senile or that they're having memory problems. But when you're really old and you've seen everything and you've seen tens of thousands of cases and you haven't trained a couple thousand doctors, you've trained tens of thousands of doctors. When you're at that 50 plus years in practice mode, a lot of those really old people, they just say, you know what, it all starts with the microbiome. We're just going to work on that first. Prebiotics, probiotics, fiber, dietary changes. That's really what we're going to do. Now, again, I haven't evolved to that point yet. I still start here unless I am forced to do something different. All right. So now I'm going to just remind you all we have this master class. I have a one-year mentorship program I do. This master class is just kind of an introduction to a little bit more about my teaching style and see if you guys feel comfortable with that. And if you want to learn more, we have tons of stuff going on at the Kalish Institute all the time in terms of courses. You can check out the website, but we're giving this away free. I don't know, if you have time to sign up for it, you might as well. It doesn't cost you anything, and watch it or listen to it when you can, and you'll learn more about it. And it goes through a whole bunch of cases with GI map lab tests. And we were talking before today when we were getting online, and we're probably going to do another one of these next quarter where I do just case after case review. Okay, we'll talk about that more in the future. Okay, so we open up for questions.
Thank you, Dr. Kalish. Yes, we do have a couple of questions. The first one is if anti-gliadin on the test is in normal range, does that rule out gluten sensitivity if they've been eating gluten?
Yes, that should. So if the patient's been eating gluten prior to the test and the anti-gliadin marker is normal, then it means that they don't have a gluten sensitivity. However, does it mean that wheat is well tolerated by them? Maybe, because there's other problems with wheat besides gluten sensitivity. Some people just don't respond well to wheat, even though they're not gluten sensitive. If that makes sense. I'm in that category. Like my gliadin markers are normal, but if I eat too much wheat, I get really bloated. So I limit my wheat consumption. I don't eat tons of it.
Great, thank you. And the another question we have is what do you do for Morganella?
Probably everybody knows what that is, but let me just show you all. So now this is a loaded question because I've already said I like to kill stuff. So in my mind, Morganella is a bad thing and should be eliminated. So I'll do a 2-month anti-dysbiosis, dysbiosis clearing protocol to get rid of Morganella with the herbs. I don't think anybody treats it with antibiotics if this is high. I don't think and I haven't heard anyone doing that because it can be a result of antibiotics for some people. So usually you want to do it with a 2-month antimicrobial herbal program.
Okay, great. Thank you. We do have another one.
Mhm.
Someone wants to know if it's true that probiotic supplements are killed by the stomach and don't repopulate the intestines.
Well, yeah. So, I mean, a couple of things are clear, and this is true for the whole field of functional medicine, integrated medicine in general, is that people have figured out treatments that work really, really well, and then they try to make up reasons why that's happening. And so probiotics are a good example of that. So, anyone that's been in practice for a while knows a certain number of people are just going to have their life changed in a very good way by taking probiotics. And so, I don't know, I think the casual assumption was that they somehow get into your intestinal tract and start to grow. And it turns out that's absolutely not the case at all, right? Because these good bacteria that we take in a capsule have to get through your stomach acid and it's destroyed there and all these other kind of stories, right? But the effect is still there. In other words, the beneficial effect is still there, but the mechanism is not what we originally thought it was. But certainly probiotics affect like the pH of the colon. Certainly probiotics affect how the bacteria in the colon are growing. But I don't think it's not like a fecal transplant, right? Where we're taking this pill and those exact organisms are then ending up in your large intestine. It's more complicated than that. But they still work, right? They still help clinically.
Great, thank you. Someone also wants to know if gluten causes dysbiosis on its own.
Oh yeah, when I worked in this lab company 25 years ago, and a functional medicine stool testing company, and we were bored one afternoon. To be honest, I think the phones weren't ringing or something, and so we literally lined up on the wall. This was when it was pre-computer, when everything was just printed. We lined up on the wall like our last 100 cases of gluten sensitivity that have been proven by lab. And then beneath them, for the ones that we had, we lined up their stool testing that showed how much dysbiosis or yeast overgrowth they had. And there was like an exact correlation, right? So the more significant the gluten reactions were, the more dysbiotic and yeast organism full the person was. It was like a direct relationship. And we're just staring at the wall going, that's interesting. We should do a study on this someday. So for sure, if you're gluten sensitive and highly gluten sensitive, the gluten's going to cause tissue damage and inflammation and destroy your immune response in your gut. And that's going to allow these harmful organisms to proliferate and grow like crazy.
That's super interesting. We also have another question from a listener. How long do you wait in case there is a backfire with killing the pathogens?
So let's say you start the person on the killing program. I would usually tell a patient, if you're feeling like if you're feeling a little bit off from these supplements, let's give it 2-3 days. If you're in their third or fourth day and it's still not feeling right, then we're going to have you stop all the supplements for a few days and restart at a much lower dose and see if a lower dose will work. And if that doesn't work, maybe a third of the typical dose, then I'll just have them abandon that whole idea and go back to working on fixing the leaky gut, getting the inflammation down, getting the gallbladder to work better, getting the liver to work better so they can tolerate the killing process.
Great, thank you. And we have another one. If H. pylori is present but in normal range and virulence factors are negative, should H. pylori be treated?
Yeah, so that is a case by case decision. Does everybody know what that question is coming from? I think people know, but let me just show in case somebody doesn't understand where. So the way that these labs are set up is there's a number, right? A rather cryptic number. It's expressed in scientific notation. So the normal range for H. pylori is anything under 1.0 e to the third. And e to the third, for those of you that skipped out on like high school math classes like I did, is a 1 with 3 zeros. So that's what the science guys are trying to say there is 1,000. 1,000, right? E to the third is 1,000. Why they don't write 1,000 out there? Because they're science guys and they use scientific notation. That's how it's done in all the research studies that you read, right? So you're just supposed to do it like that. But it's confusing. So this person has 2.9 e to the third. Well, if you're going to translate that into regular math, that would be 2,900. So clearly 2,900 is pretty far above 1,000. But you might have a result which is like, let's make it tricky. What if it's no, let's say it's 2.1 that's not coming out really good. My drawing's not great. Here, 2.1 e to the second. E to the second. Okay, that is so not clear. Let me see. 2.1 e. Anyway, I'm saying it. So 2.1 e to the second. Then you think, wait a minute, it's a 2, but it's a 1, and what does it mean? So, but draw that out. So 2.1 e to the second is 20 is a 2 with 2 decimal points, right? It's 210. So in that situation, let's say that they have 2.1 e to the second, that means 210, and the cutoff is 1,000. So they're far below the normal, they're still within the normal range, okay? So you do all that math, right, and draw it out. And be careful when you're looking at these because it's confusing to patients. If it's 2.1 e to the second, and then their patient's like, well, wait a minute, but anything over a 1 is a problem. You have to tell them about the exponent thing. Okay. So anyways, let's say that they're 2.1 e to the second, so it's 210, and the normal range is anything under 1,000. And there is a normal range for H. pylori. That's why they have it written on here, right? So you would think there'd be no normal range for it, but there is a normal range for it. And so that then becomes a clinical judgment as to whether you want to treat it or not. For example, I had a patient last week, this just happened, exact same scenario. H. pylori was found, right? They found it, but it was underneath the normal range. However, she had really bad gastroesophageal reflux, and she had had blastocystis in the past. And I was like, okay, you got the symptoms for it. The lab is a little ambiguous, but let's just treat the H. pylori. You probably wouldn't want to do a really radical 2-week antibiotic protocol, but you can certainly do a very effective 2-month herbal program and just nuke the H. pylori. And I've been using mastica or mastica gum for H. pylori since I met Dr. Timmons 30 years ago. It seems to work, so that's just been my go-to treatment. Everybody seems to underdose it. I don't know why, but Timmons taught me, and I still do this to this day. It sounds like a lot, I know. 1,000 milligrams of mastica 3 times a day, breakfast, lunch, and dinner. 2 months of that gets H. pylori, 8 out of 9 times, according to the last study that we did. Okay.
Thank you so much, Dr. Kalish, for this presentation. We've got a lot of other questions that are going to be sent to our education team. And if you missed part of this presentation, the webinar will be up on our website within 1 to 2 days. And please don't forget to register for Dr. Kalish's masterclass at kalishinstitute.com/GIMAP. Thank you, everyone, for joining us, and we'll see you next time.